For a lot of us, feeling younger starts with looking younger. These days, there's a growing movement of patients taking their health into their own hands and skipping the waiting room altogether. Take a look at how one company is redefining how you can access expert care. More and more people are rethinking what it means to take care of their skin, opting for personalized, science-backed treatments that fit their lifestyle.
When I start with a patient, we look at, honestly, their whole life. So I ask them typically, what's bothering you? And that may be something very simple, or it may be a deeper skin problem. Really, everything that we do has an impact on the skin. Diet, lifestyle, smoking, tanning beds, everything. Skin Clique is aesthetic medicine on your time, your demand. So we have a huge network of providers that are coming to your house, coming to your office, you're going to their office, but the whole concept is on your time.
I'm a business owner. It's just feels like the right thing for me at this time in my life, especially for someone to come to my house. It's really nice.
From treating hormonal breakouts and melasma to offering microneedling, peels, injectables, weight loss, and more, they offer medically founded care focused on long-term skin health and confidence.
I actually have started to learn a lot more about my skin that I didn't know.
It's honestly, whether it's a 25-year-old struggling with acne or a 60-year-old going to their high school reunion, everyone just wants to feel more confident.
Skin Clique is revolutionizing how care is delivered, helping clients feel empowered, educated, and confident. Dr. Sarah Ellen is the Chief Medical Officer for Skin Clique, and she joins us now. Thank you for being here.
Yes, gosh, thank you for having me.
So before the cameras heated up here, I was saying I'm such an advocate for home care of all types and for distributed services amongst physicians and nurses.
Right.
Tell us how you're meeting the need of the patients.
Skin Clique, we really saw that there was a need for accessible, approachable care, because you and I both know when you meet a patient where they are, the relationship that develops is so unique and important. That relationship builds trust, and Skin Clique really takes all of that out of the equation.
We're even embarrassed to go into a waiting room and stuff.
Yes,
And so who should the patient be?
Yes, so our patients are everybody. I tell our providers all of the time, we are for all patients. So we take care of you from start to finish throughout your skin health journey to help keep you well. And to help you put your best foot forward.
And how did you connect with Claire?
Claire and I actually used to work together at the VA hospital in Charleston, if you can believe it. She was a nurse at the time and then went on to get her nurse practitioner degree, and I was a medical resident. And so we reconnected years later over our shared love of accessible and approachable care for patients.
And what are the spectrum of services?
Yeah, so we offer injectables, so tox, dermal fillers. We also offer treatments that allow you to make your own collagen. We offer medical or clinical grade skincare consultations, and then an array of virtual care services that we can talk about.
Sort of like a telehealth kind of visit.
Yes, yeah. I'll say every procedure that we offer at Skin Clique is thoroughly vetted. I'm a clinician and a physician at heart, right? And I always want to make sure that the treatments that we offer our patients are safe. So we vet everything through a rigorous protocol, and all of our treatments are evidence-based.
Is there challenges to at-home services?
So I found as we created the practice, we were able to overcome all of those challenges. I know one of the common questions that we're asked is it really safe to do procedures in the home? And I knew that I wanted to make Skin Clique as safe as possible as we started this practice. So all of our providers, our nurse practitioners, physician assistants, and physicians, they undergo the most rigorous clinical education available in this part of medicine with 5 times more hands-on training. We all have standardized protocols, emergency protocols and equipment. And for us, flexibility doesn't mean less structure, it means more intention.
Now, this may be an impertinent question, but you have such deep medical services, and it's focused on aesthetic, but it feels like you could do more than just aesthetic services. Are you doing that?
So great question, yes. So Skin Clique really has always believed that we exist to help our patients feel confident. So with that, we're extending beyond beauty, and we're offering prescription dermatology services, prescription hair loss procedures, medications for weight loss. But the most important thing is you have a one-on-one relationship with your healthcare provider provider that you can call any time of day.
1000% agree with you.
Thank
That
you.
the future is in the home, including
Yes.
blood draws and
Agreed.
treatments and everything. We're
Yes.
going to have ways of doing all that
Yes.
eventually. So.
Yes.
But and then you'll have your aesthetic providers, you'll have your derm providers,
Yes.
you'll have your medical providers.
Yes.
So it's very interesting.
It is, and it's an exciting time. And this portion of medicine is expanding so rapidly, so it's important to have a medically based provider that you can trust,
Yeah.
that you know their training, you know their credentials.
Yeah, I was just going to say that people don't know how to ask for doctors' credentials.
Right.
Start with board certification.
Right.
It's the first thing you got to know.
Yes.
Are they board certified?
Yes, and you're never offending us to ask.
No, we want to. Those of us that have the training, we want to tell you
we're
about
excited because we worked really hard for it.
Yeah,
and we
where are
love
we
to
with
tell
our professional
people.
societies? Are you member of the ACP?
Yes, yes.
And so these are, you wouldn't even, people don't know to ask these things,
Right.
but it's really important
It
that they
is.
do so.
It
And
is.
those are the people you want in charge of the services. So.
Yes, and it's our job to help patients.
Skin Clique, skin, the word skin, CLIQUE, skinclique.com. More Health Uncensored after this.